Okay, so it is go time. It's 12 o'clock. So thank you all for joining us today. I just want to go ahead and give you a brief introduction of myself. Today's hot topic is going to be on shoulder impingement, and just really, any questions you might have about your shoulder pain. I won't be providing any treatment through this webinar. It's just simply educational. But I want to just go ahead and just thank you for taking your time to go to follow along with me today. So full disclaimer to get started. I just want you to know that this information provided to you today is simply for educational purposes only, and it's not to be substituted for any medical advice. Should you need any medical advice, I just advise you to go seek that care from a doctor or healthcare professional. Okay, so and as we go along, if you might have any questions as we go along through this webinar, just feel free to send a question through the chat, or if you're more comfortable with holding your questions until the end of the presentation, that's absolutely fine as well. But I will try my best to answer any questions you might have as long as I see them appear in the chat here. So a big question I'm sure you all are asking is, who the heck is she? Okay, so my name is Michaela Riley. I'm a doctor of physical therapy. I also go by Mika. It's just much easier to say. Just a little bit about my education. I received my Doctor of Physical Therapy from the University of Washington. After graduating with my doctorate, I went on to pursue higher training and got my orthopedic residency through the University of Washington. A little bit of history of where I've worked. I actually just started and joined MoveMend's team nearly almost a month ago now. And it's been great. And prior to that, I worked for UW as well, and I taught in the physical therapy program as part of the residency, worked as a full-time clinician, and acted as a clinical instructor, teaching the new generation of PTs. I also have had opportunities to work at the Sounder facility with high-level athletes, recreational athletes, you name it. And a lot of shoulder and lower extremity injuries. So that's just a little information about who I am. But today's objective really is to go through shoulder pain and see if you being here today might be because you are experiencing shoulder pain. It might be because you work in an occupation where you have to lift heavy things that require you to lift them over your head, and at some point in time you're getting pain. Or you simply work for a tech industry around here, and you're sitting at a desk or a station in your home now for 8 hours a day. And you're starting to feel some things after that. Or you've suffered injuries in the past that continue to linger on and you're just kind of tired of that. Or your shoulder pain might be limiting your ability to care for yourself or even care for your loved ones. Or you're unable to work out because of your shoulder pain, and that can be quite debilitating. But today is really, to hone in on the objective for today, it's really to educate you about what shoulder impingement is. And at the end of this webinar, I really hope it provides you information regarding your own shoulder pain and helps you make decisions about your shoulder health and what resources are out there for you to help reduce that pain and get you back to doing what it is that you really enjoy doing. So to go along, I call this the shoulder pain guide. So whenever I have somebody come into my clinic and see me, I usually, for shoulder pain, I usually take these things into consideration. And this is kind of my guide on how I help you. And so the first thing is I really want to identify the range of motion or the area or location that you're experiencing any pinching sensation or any pain in general. The second thing is I want to really identify the structures that are involved. Is it a bone? Is it a muscle? Is it other tissue? And then the third thing is I really want to identify the root cause. Why are you having this? And what's the reason for you having this? Okay, so we're going to go on to the first part is the location of the pain. And to kind of understand what the shoulder is, I'm sure you all know that has a ball and it has a socket, and there's some muscles, rotator cuff muscles around there. But let's kind of dive in just a tiny little bit deeper to kind of understand what area we're really talking about. So what we see here, I don't know if you see my arrow here, but here we have the shoulder joint from the side view. We have the front of the shoulder and then we have the back of the shoulder here, okay? So here's the front, here's the back, okay? Let's see if you don't see the arrow. Okay, so I will say left and right if that's okay for you. So on the left side, you have where it says acromion, okay? That's the front of your, excuse me. This is the front right here, the coracoid, and then the acromion comes through, and that's where in the red we see here, that's the subacromial space. That's where we tend to have some pinching. That's where a lot of this occurs, okay? There are a lot of structures that go through this space. It's a pretty small space, as you can see in the red areas, and it's pretty easy to impinge or pinch on structures within these arches. There isn't a lot of room for error. In fact, it really isn't a blank space. There actually are a lot of structures running through the area, including your rotator cuff musculatures, or in terms of your tendon, and even a fluid sac. So on the right-hand side, you can see kind of more the muscles that we're kind of talking about. You have some muscles that come in from the front, and some muscles that come in from the side, and some muscles that come in from the back. Namely, we have 4 rotator cuff muscles, and those are ones that are pretty involved in this space, okay? So it's kind of like the analogy of you have a small hole and you try to fit a lot of cords through it. That's the space that we're looking at, okay? But I want to tell you something. Get ready, because I'm about to blow your mind. So we think of impingement as a negative thing, but actually we impinge every single time we move our arm. We all do. And impingement of these structures is normal, and it happens in all of us every time we use our arms. It's when this becomes abnormal and excessive and too frequent that the shoulder pain and pathology actually begin to occur. It's why it's very short-sighted to say that impingement is normal and that people should work through their discomfort. Yes, some impingement's normal, but excessive impingement is what may cause pain and pathology down the road. For example, maybe it could lead to a rotator cuff tear because it's become so degenerated and overused that that's all that's left. So when it comes to the structures involved in impingement, I try to make sure that I differentiate between the location of where you're experiencing your symptoms. And so now what we're going to do is kind of go into the areas, the 3 things: the primary impingement, secondary impingement, and internal impingement. Those are the areas that we're wanting to look at. So simply put, we'll start here with primary impingement. Simply put, primary impingement is due to your anatomical makeup, how you genetically were made, how you grew up, particularly with the acromion that you see here in the picture, where you see that little red edge on that bone there, okay? People with a curved or a hooked acromion are predisposed to potential pathology down the road because of the mechanical nature that causes overcrowding in the space. So you think of, normally we'd like to see people with a flat acromion, but some people, primarily their cause will be because it's either hooked or it's a little curved. That sometimes what ends up happening is we already know that space is small. It gets even smaller and doesn't give you enough room to move. So you're pinching a little bit sooner than most would. Now, there are 3 stages within this where it's really age dependent. And it also depends on how involved your rotator cuff is, which we commonly see in these populations. But I'm not going to get into the nitty-gritty details of all the stages, but I will say that we commonly see people around the ages from 25 to 40, 45 years old, and we refer to this as stage 2 in this impingement, after they've had, repeated episodes of inflammation and irritation of structures within that space. Now, why 25 to 40 years old? Well, life happens, the work, kids, everything, life happens, so they're like, oh, well, it got worse. I rested a little bit. It gets better. Okay, let's go back to doing what I enjoy doing. Shoot, it got worse again. And the cycle keeps going and going. Or we see an increase in activity where all of a sudden they're like, I really want to take up tennis. And it might be something that they haven't done in a very long time, or something they've never done before. And then, simply put, as you get older, we have normal age-related changes that also affect the way the shoulder joint moves. Now, I will note, as our knowledge of impingement, of shoulder impingement is improving, a lot of this has to do with the structure of the joint, the structure of the joints that make up the shoulder. And a lot of times is people who do a lot of overhead activities and do this repetitively will tend to eventually, wear down a part of the bone in the shoulder joint that causes a bone spur. And that bone spur sometimes can be a little sharp, or it can cause a little curve. And that also can hit on very vital structures in that space, such as some rotator cuff tendons, which can be pretty problematic if that should occur. Now, what is the pain that they typically experience with this type of impingement? Any repeated motion overhead is quite painful for them. Any reaching across the body, reaching behind the back, you'll hear women say, I can't put my bra on. You'll hear men say, I can't put my wallet in my back pocket, or I can't get my belt loop through the hole there. Or I've just increased my activity and then now I'm here. And they'll typically describe symptoms as, it's a toothache feeling. I can't sleep on my side. I love to sleep on my right side, but my shoulder hurts really bad. I have pain that gets worse when I put dishes up in the cupboard. And then it gets to the point where they eventually have reduced strength and reduced range of motion. They kind of will have a sense of that. Now, physical therapy, when we talk about primary impingement, it's because, you might have some mobility, some strength and stability issues that we can absolutely treat. But I want to make it known that primary impingement means that something inside the joint is causing the symptoms, and it's something that we might not be able to change. So our treatment, absolutely, we can improve the symptoms, and oftentimes are successful with rehab with people who have primary impingement. But I will be honest, sometimes we just aren't with this type of impingement. And it's not because a certain type of treatment isn't effective for shoulder impingement. It's because there's a primary reason why impingement is occurring that we can't change. So without addressing the primary issue, like maybe a large bone spur, or the way that your anatomy, if you have a hooked acromion, working on secondary issues might not be effective. But it goes without saying, if we don't try, we won't know that. So let's move on to secondary impingement. So secondary impingement simply means that something else is causing impingement. Perhaps it's activities that you're doing, your posture, you have a lack of stability of the shoulder joint, muscle imbalances that might be causing the ball and socket joint to shift a little bit and cause that impingement in that space. The most simple example of this is a weakness of the rotator cuff muscles that can cause this. The rotator cuff and larger muscle groups, for example, here in the front, they work together to move your arm in space, simply. The rotator cuff works to steer the ship by keeping the head or the ball in the socket joint. And the deltoid, this front muscle here, and other larger muscles, they power the ship and help move the arm. So both muscle groups need to really work together for this to happen. If you have rotator cuff weakness that's present, the cuff may lose its ability to keep that ball in the socket joint. In this scenario, you'll have the bigger, larger muscles, for example, the deltoid, that will overpower the rotator cuff muscles because the ball in the socket joint is starting to shift a little upwards. And these are movements in the joint that the rotator cuff just doesn't really know what to do with. And then it'll cause some impingement of the rotator cuff muscles or the tendons under that acromion. This is just a simple example, but as you can see, it can be very impactful for shoulder function. It's not just weakness of the rotator cuff muscles, but it's also imbalanced strength ratios and improper timing of stabilization of the joint. Other common reasons for secondary impingement include maybe you might have some mobility restrictions, poor dynamic stability. So being able to move your arm and have that ability to stabilize the shoulder. Maybe you have poor coordination of the shoulder blade because that shoulder blade helps make up that shoulder joint. So it's directly related. So we need to look at that as well. And then even the thoracic region, so that mid-back region. Sometimes if you have stiffness in that region, it also can alter some mechanics at the shoulder joint. All of these areas need to work together to produce optimal shoulder function. And I see a lot of this in my patients. So let's move on to the last one, posterior impingement. So posterior impingement is a whole different beast. This type of impingement, it's commonly seen in overhead athletes that are typically less than 25 years old and is really the result of some what we call hyperlaxity, but what I say is loosey-goosey joints, specifically the shoulder joint. And it's loosey-goosey, if you will, in certain directions. And for this population, it's typically in the anterior direction. So that ball kind of shifting forward. So as the athlete, so think about a baseball player, pitcher, for example, they get into this position, this cocked position, and they actually have quite a bit of range, and pitchers are actually pretty loosey-goosey in this range. Now, as they get into this position, this is where they tend to experience that pain because two of the four rotator cuff muscles are starting to pinch in that region, but this time it's on the back side. And so every time they get into the cocked position, they start getting that pinching feeling, that pain feeling. And then the other thing is when they start accelerating the ball and following through, they'll start getting some symptoms as well because they don't have the ability to stabilize and the strength and coordination to really make sure that ball is staying in a prime spot within the socket. And symptoms for them are commonly felt during motion or during the activity that's most aggravating for them. Okay, so now I hopefully didn't bore you and make things go over your head, but what I really want to get down to is what can physical therapy do for you? What can I do for you? And can it be helpful? Absolutely. Physical therapy is a great place to start your journey of conservative care. We will provide you with an evaluation that's detailed and leads a systematic approach to help identify the root cause of your shoulder pain. The goal of physical therapy is really to manage your pain, restore any mobility deficits you might have, address any postural issues that might be contributing to your pain, and simply really improve the way you move so you can return to whatever you desire to do. All three of these types of impingement can be improved with PT. It depends on the tissues involved, and there are a lot of things that we need to consider. But people typically respond well within the first few weeks of physical therapy, and their symptoms usually reduce by at least about 25% within the first couple weeks. And, it's not simple stuff that you do. We need to make sure that we get you back to what it is you want to do. Is it swimming? Is it picking up your kid? Is it doing a snatch in CrossFit? Whatever it may be, that's what we're here to help you with. That's what we do for you. And the earlier you can seek PT, the better. You shouldn't have to live 3 months, 6 months with shoulder pain. The earlier you can get in, and earlier interventions can help stop a problem from becoming an even bigger problem. The shoulder is a delicate joint, and if things aren't addressed sooner, you can injure the joint further. So I want to take this time to address any questions that any of you might have for me. So I hurt my shoulder about a year ago in weightlifting. I've had intermittent pain since. Is it too late to do something about it? Absolutely not. I think, there's probably a lot of maybe a little bit of scar tissue involved with your incident, and maybe some coordination issues, but those are all easily addressed. Does that mean that you should go keep lifting weights if it hurts? Maybe not, but you might need to modify. So I think physical therapy would be ideal for anybody in a situation like this. A year is not too late. 5 years, you keep going and you might be having more than just one thing go on. Any other questions? Okay. So should you have any more questions, or maybe even want to take the route of physical therapy to help you and help your shoulder pain, feel free to get a hold of us at MoveMend. Our contact information is at the bottom of the screen. You can feel free to email MoveMend with any question you might have, or if you're interested in a potential free screen from me. I do both in-person and virtual screens if you need that. We are in compliance with the COVID-19 protocols and are washing our hands and doing as much as we can to keep our patients safe. So I hope this webinar was very helpful for you, and I really hope that this helps guide you and makes decisions regarding your own shoulder health. So thank you so much for joining us today.